Greetings everybody. Today our topic of discussion is phases of general anesthesia and general surgery. Uh, First of all, we should know about the definition of anesthesia. What is anesthesia? It is actually a drug-induced reversible state characterized by sedation, analgesia, and muscle relaxation. What is anesthesia? It is a drug-induced reversible state drug-induced reversible state characterized by three things. First one is sedation, second one is analgesia, and third one is muscle relaxation. Muscle relaxation. Always remember this definition. Drug-induced reversible state characterized by the sedation, analgesia, and the muscle relaxation is called anesthesia. So our main topic is phases of general anesthesia. Actually, general anesthesia is divided into three phases, but here we will add an extra one step which is called the pre-induction phase. Pre-induction phase. Pre-induction phase means before setting off sedation or amnesia, there is a phase which is called pre-induction phase. And what we will have to do in pre-induction phase, we will check 3-4 things. The first one is to monitor the BP of the patient, because we can't sedate a patient with a high or very low BP. So monitor blood pressure. The second one is manage or monitor the oxygen saturation. Above 92%. 92%. You should maintain 92% saturation at least. Then you will go to the induction phase. The third one is maintain the temperature of the patient. You can't give sedatives into a hyperthermic patient or the hypothermic patient. Always remember. So first of all, you should maintain the blood pressure of the patient, the oxygen saturation of the patient, and the temperature of the patient. The fourth one is give it analgesia. Give analgesia, because analgesia is painkiller and it takes time. Its effects starting takes so much time, so you will give analgesia in the pre-induction phase. Like for example, you will give midazolam, which is a benzodiazepine. The fifth stage is give anxiolytic drugs. Anxiolytic drugs is to reduce the anxiety of the patient before giving the sedation. Because if the patient is anxietic, it may have some post-operative complications. So in pre-induction phase, you will do to monitor the blood pressure of the patient, oxygen saturation of the patient above 92%, the temperature of the patient, give analgesia because its starting action takes a lot of time, and anxiolytic drugs to reduce the anxiety and to prevent the post-operative anxiety complications. Now, another stage is phases of the general anesthesia. There are main three phases which are included in the textbook, but this step is not included in some books. So you will must write this stage 2, this phase 2. The first phase according to the book is induction. Induction means setting off sedation plus amnesia. Like we have studied previously that you should give sedatives to set sedation and amnestic to set amnesia. Like we have studied IV two types of agent. Number first one is sedative agent, which is used as intravenous injection form, which is used in a IV injection form. And the second one is inhalational agent. Second one is inhalational agents. This sedative agents, which is used in IV form, is used as induction agent. And this inhalational agent is used as a maintenance agent. Remember the name of the IV injection, IV agents. We have studied the most common one, which is propofol, whose mechanism, whose action time is 90 seconds, with the least side effect, with the least post-operative complications, nausea and vomiting. The inhalational one include isoflurane, sevoflurane or halothane. Isoflurane, sevoflurane and halothane. But the most commonly used is sevoflurane. And this is a MCQs also. The most commonly used inhalational agent in induction is sevoflurane. Patient will goes to sedation after the propofol injection, which is usually used 1 to 2 milligram per kilogram of the body weight. 1 to 2 milligram per kilogram of the body weight. So the patient will go to sedation just to prevent the big fall of the tongue. We will do two types of procedure. We have studied previously the chin left procedure and the jaw thrust procedure, who has some types of contraindication. Like we have studied that chin left procedure is contraindicated in a patient with cervical spine injury. And the jaw thrust procedure is allowed in a patient with the cervical spine injury. So after giving the sedation, you will manage the airway by the chin left and the jaw thrust procedure. Airway management plus ventilation by the ETT, endotracheal intubation. And the third step is you will give muscle relaxants. The first one is give sedation to the patient. The second step is manage airway management. And the third step is give muscle relaxants. Like we have studied the depolarizing and the non-depolarizing relaxants. After this, always remember, after giving the muscle relaxants to the patient like the succinylcholine, you must have to shift the patient to the ventilator, because the muscles can't contract after giving the muscle relaxants and the patient can't breathe by itself. So the patient must be shifted to the ventilator after giving the muscle relaxation or muscle relaxants such as succinylcholine. And always remember, muscle relaxants used here is succinylcholine. And succinylcholine, we have studied that this is short-acting drug, plus rapid recovery. The fourth stage is maintenance. And always remember, maintenance is done by the non-depolarizing agents. Maintenance done by non-depolarizing relaxants, depolarizing relaxants. Like for example, atracurium. We have studied that atracurium in our previous video, the drugs used in the general anesthesia. We have studied the atracurium. The most commonly used maintenance agent is non-depolarizing relaxants, which is atracurium. Always remember that this dexamethasone, which is a short-acting and rapid recovery drug, is used generally in two types of surgeries. Dexamethasone, this is MCQs also. Dexamethasone is used mainly in two types of surgery. The first one is C-section delivery, cesarean section delivery, and the second one is emergency surgery. Emergency surgery means if a patient came or brought to the emergency with a full stomach, So the patient is brought to the emergency with a full stomach, you will use the muscle reluctant dexamethasone because it has a fast acting and rapid recovery drug. So with a full stomach patient, we will use dexamethasone. Dexamethasone is a muscle reluctance. As we have studied that we will manage the airway through ventilation. So ventilation has also three levels of ventilation. Number first one, ventilation must have volume control to prevent the overflow of the air inside the lungs, because then it will cause the overinflation of the lungs. And the second one is pressure control to prevent the high pressure air into the lungs. 3 is positive end expiratory pressure, which is called PEEP, positive end expiration pressure. This one is the best ever level because it prevents the alveolar collapse at the end of the expiration. The second stage is maintenance.